Things started here. Okay, so yeah, it's recording. So today's lecture is the very last lecture for this course. Thank you very much. We're done after this lecture. And today's lecture is Complementary, Alternative, and Integrative Medicine. It's, I think, a very important topic to discuss because it's now very popular with patients, and I think we'd be doing a disservice to our patients if we didn't actually know what any of these terms mean, okay? That being said, this lecture is going to be more of an introduction kind of review of what's out there so that you know, if a patient's doing, chiropractics or they're doing massage therapy or they're going to an acupuncturist, you know what sort of treatment that is, what it's for, why people use it, and really basically all the different things that are out there and how you integrate that into your regular care. Like, why do you care that patients are doing it, and why do we need to make sure that we monitor what's going on? So that's basically what we're doing today. So it's a very introductory, rudimentary lecture. Don't expect me to go through all of the different alternative treatments that are out there because, I mean, we could be in here for days upon days discussing everything that's available. But we'll give you kind of a nice overview of what to expect. Now, the first place that we'll start is with definitions. And if I actually project this would be nice. So we'll start with definitions, okay? So what you missed was just the title slide, objectives, which you have, and standard medicine. So now we're on to objectives. So what is standard medicine? Well, standard medicine is what you know, what you've been studying this whole time. Every single module in ICM, everything you've done in pharmacology up until now, and pathophys, you've been learning what we call standard medicine, okay? Basically, it's what we practice, or what MDs and most DOs, or all DOs, practice in this country, and in most of the Western world. We're talking about what we know to be as standard medicine, okay? It's what's orthodox. It's what's called sometimes allopathic. That might be another term that you might hear. You might hear about Western medicine. When referring to Western medicine, we're referring to the standard medicine that we practice, specifically in the United States. You might hear it called mainstream or orthodox or regular medicine. So these are some of the AKAs that are out there to just basically describe what you're learning to do in this program using the medical model specifically, okay? Now, the next term is complementary medicine, and this is complementary with an E, not an I, okay? Complementary medicine are treatments that are used along with standard medical treatments, but are not considered to be standard treatments. One example here would be using acupuncture to lessen some of the side effects of cancer treatment, or using acupuncture for, say, like a Bell's palsy on someone's paralysis on their face, okay? Those would be examples of how we would use complement, because what you are doing, what you are seeking outside of standard of medical care is to complement what the standard is, okay? So it's kind of in a conjunction, if you will. As opposed to the other form, which is alternative medicine, that's completely different. So this is a system or a method that is completely outside and independent of standard medical protocols or standard medicine. So here we would be saying, okay, we're going to go ahead and do a special diet, and that's going to be the treatment for cancer, okay? Irregardless of radiation, irregardless of chemotherapy and whatever the cancer center at MD Anderson in Houston said to do, we're going to go ahead and just do a diet. That's what I want to do for my cancer. That's how I'm going to cure it, okay? Kind of like what Steve Jobs decided to do for his cancer. He decided that for his pancreatic cancer, he would not go the traditional standard medicine route, and he went with, more of these alternative medicine things, and, well, it didn't pay off in the end because obviously, he didn't survive that. And so by the time that he did latch on to standard medicine, it was already too late to do that. So alternative medicine can sometimes be positive and negative, just depends. And alternative medicine tends to be very connected to culture as well. And so in different parts of the world, you might find people that are following definitely alternative medical systems for sure. Specifically in Asia, people go to other kinds of, or Chinese medicine, for instance, instead of seeking standard medical care that is based on Western or very orthodox rules, if you will. What is integrative medicine? Well, this is a sort of a newer term, and it's really where we want to be as practitioners, okay? Integrative medicine is basically a model of medicine that we can use to integrate both things that are complementary and alternative and standard medicine together, okay? A lot of chiropractors will argue that they do a lot of integrative medicine, and that may be true in a lot of cases. Osteopaths, like Dr. Jones, also argue that a lot of what they do is very much integrative as well, because they do combine elements of the complementary medicine with standard medical practice as well, and how we learn medicine. So integrative medicine we're going to touch upon at the very end of the lecture again, because it's definitely sort of the route that you want to take. It's not a requirement, but you're going to find that if you do embrace some of these integrative techniques and skills, you're going to find that your patients are probably going to be a little more happy with you, because there are plenty of patients, as we'll find in some of the statistics that I have on today's lecture, you'll find there are plenty of patients that are very interested in following some of these other methods of treating their health. So when discussing complementary and alternative medicine specifically, the CAM section, and we'll save, like I said, integrative medicine for the end. As far as CAM is concerned, there are 5 different domains that you have to think about. The first is biologically based practices, which are very common. These include things like diets, herbs, and vitamins. And so, you know, how many of you in here take a vitamin? Yeah, lots of you. How many of you take herbal stuff or have ever taken herbal things? How many of you have done special diets, gluten-free and whatnot? Yeah, or to treat any kind of condition. You know, there's a lot out there. So those are some of your biologically based practices. Manipulative and body-based practices. Anybody in here ever had a massage? Yeah, exactly. Okay, so that's where this particular type of practice falls in, because these are more manipulation. Energy therapies. Anybody ever had some of these done? Anybody here from? Oh, we've got a couple of people. Anybody from California, Colorado, Oregon, Washington State? Yeah, those tends to be the states where you see a lot more of the energy therapies being implemented. New Mexico, Arizona tends to be very popular. So it's definitely a Southwest and Western, West Coast type of thing that you see just a lot more common. Mind-body interventions. Anybody do yoga, meditation, those sorts of things, stretching, all of that goes in this particular area. And then finally we have alternative medical systems. So anybody Chinese medicine, homeopathy, anybody like that? There we go, yeah. So we've got some that do this particular thing here. So even within ourselves in this classroom, we have a lot of hands going up, okay? So we don't even need to go out to the general population to find out that these things are quite common, because in fact, most of you in here raised your hand at least once to any one of these domains, okay? I think it would be very difficult not to at least be familiar with any one of the things that are in here. Now, there's some things with, you know, crazy names and, you know, what the heck is that and how does that work? So there are definitely things in here that are worth researching and finding out what they are and how they can help a patient with a particular condition that you're trying to treat. And so they're easily look-upable, if you will, if that's a word. You can find them definitely online for sure. And I've given you some resources also on the web that list many of these and why they're used and some of the risks and benefits and what diagnoses are typically good for these types of things. So looking at each one, so we look at alternative medical systems, and these are, like I said, typically they're complete systems that are completely outside of standard of medical care. In fact, these systems really encourage you not even to seek medical care, just seek this particular system, okay? You've got to be careful with these, because sometimes these can be efficacious and sometimes they can actually be detrimental to the patient. So as someone who is practicing integrative medicine, you really want to analyze and assess what patients are doing and why they're seeking these particular items and whether they're helping or not, or they're hurting, in fact. So, you know, you can have both of them here. You have a list of some of the things out there that are being done. And you'll notice also some of these are definitely regionally, geographically based. Some of them are culturally based. Some of them are racially based as well. So you also have to keep that in check, and also keep that in mind when you are kind of assessing what your patient is doing. So these are the alternative medical systems. Then we have the mind-body intervention. So Lots of stuff out there, okay? And these are going to be using a variety of techniques to enhance the mind's capacity to either heal itself, fix itself, or get rid of the symptoms. And there's a long list of things here, all of which can go even longer. This is not an exhaustive list, but some of the more common things out there that you will see. You know, the trouble with a lot of these things is sometimes they can be seen by the traditional medical establishment, that is standard medicine. They can be seen sometimes as a little bit hippie, a little bit crunchy, or a little too, you know, out there, spacey, and you know, whatnot. I've heard all sorts of words for some of these things, okay? But, you know, I never actually judge a patient for what they tell me, like, oh, I'm going to hypnotherapy. In fact, Dr. Jones does hypnotherapy. And so, you know, I'll never judge a patient for going out and seeking extra things to improve their health care, but I do want to open that dialogue, and that's a very clear point about this skill at the end of the lecture, is that you do want to have that discussion with patients and find out what they're doing. If you never ask about it, they will never tell you, and we'll find that out in just a second also. But if you ask about it and they tell you, you want to investigate that, okay? So why are they going to hypnotherapy, or why are they meditating? What does it do for them? I put meditation in there twice, sorry. What does yoga do for them? What do they find that it helps? Does it relax them? Does it help their back pain? Does it hurt their back pain, perhaps because it's so many, you know, different positions? Are they getting any benefit or not? And if they are getting a benefit, and if it's not hurting them, then what's wrong with that? Okay, and that's really the whole part about integrative medicine that's nice, is that you can use what patients' expectations are and what they bring to the office visit and use that to help them, okay, as long as it's not hurting them. The next one is biologically based practice. It's probably one of the more common. We'll find out what's most common in just a second. But you find this a lot, especially with the winter Texans and the older folks, okay? In geriatrics, people are tending to take a lot of these herbal supplements, dietary supplements, going to GNC. Your workout crowd, your gym rats are using a lot of these things also, always in the vitamin stores and vitamin shacks and the protein stores, getting their protein shakes and their herbal supplements and their stimulants and, you know, all of these other things. So these things are all quite common, not just in the older population, but you see it in the younger population also, that in fact live very healthy lives, and they're using this a lot to supplement their health. You also find now in certain states, you also find marijuana. Now, we don't have to talk too much about marijuana because it's not something any PA has to worry about. You know, in the entire United States, marijuana is still a Control 1 substance, which there is no state in the union that a PA can prescribe Control 1 substance, so you wouldn't ever have to worry about this. However, you may have patients that are being treated with medically necessary marijuana in your office if you decide to move to Colorado, California, Washington, Oregon, I think. Yeah, so if you decide to move to one of those 4 or 5 states and practice medicine there, you may run into people who are definitely being treated by your physician with this type of treatment. So you'll want to make sure that you know about it. You know, what are the benefits? What are the risks of using, you know, marijuana-type products for health specifically? Manipulative and body-based methods. So these are going to be those methods that are based on manipulation or movement of one or more parts of the body. They're all listed here as well. Some of these are very common, specifically massage therapy, I think, is a quite common one. And some of the other ones are going to be more related to whether or not really patient knows about them, if there are providers in the area that provide these. And speaking of providers, it can be difficult to find providers that are even offering these services because in some states, these providers are not licensed to work. So for instance, homeopaths and naturopaths, which are very common in some other states, they don't exist in Texas. And although people who have those degrees and those credentials might actually live in this state, they can't practice officially in this state because there's no career for them by law here. So they can't actually practice alone as naturopaths. But if you go right across the river into Mexico, you know, naturopaths are actually quite common, or homeopaths actually are quite common right across the river. And so you'll find a lot of people actually seeking that type of care across in Mexico, even though that they don't live here. So you've got to consider that if you're planning to live and work in this area, you've got to consider that people do go across the river, not only to get their own medications and seek medical care there, but they're also seeking some of this complementary and alternative medicine out there as well. Then, of course, there's also this culturally based sort of Hispanic Mexican thing around here with the curanderas and the faith healers and whatnot, with the eggs and the spells and the herbs and the teas and whatnot. There's a big variation in what they do. And so, how is that helping, or is it not helping, or is it hindering the process? And so you've got to definitely assess that. Energy therapy is probably the one I know the least about, okay, and probably the one I would want to read the most about, because it is definitely very interesting. So there are generally two types of energy therapies out there. They're either biofield therapies or they're bioelectromagnetic-based therapies. And some of them are listed here. For you Harry Potter fans, I put one in there, see if you catch it. But in any event, that's just a joke. Don't learn that for the Raxperts is just a joke. It's not for the test, so don't learn Raxperts, okay? So if you've seen Harry Potter and you're a fan, you know what I'm talking about. So these basically here they're the most difficult to understand because it's like thinking that a crystal that you wear around your the door's open, no wonder. So it's like thinking that a crystal that you wear around your neck is going to somehow collect, evil spirits and give you good energy and whatnot, or that fact that you wear, a little red string around your wrist is going to, detract bad energy and attract only good energy, or catch all the evil spirits. Wearing a piece of amber on yourself is going to give you good energy, or whatever, or that you wear a copper bracelet around you is going to give you good vibes, or you wear these crazy little bracelets that have something in them that are apparently going to make you work out better. I don't know if you've seen those. Again, I'm not trying to judge these things, but I want to talk to my patient about, what do you think this is doing for you? Okay, look at the literature. The literature is pretty much both positive and negative. I mean, you're not going to find anything, I think, that says definitely these bracelets are going to make you work out better. But you know what? If the patient is getting a better workout and they feel more energetic from it, hey, why not? Okay, if it works for them, I'm not going to tell them to stop doing it unless it's hurting them. So if I look at where that bracelet is at, for instance, when I had this Fitbit on, it created this horrible rash. I guess I had an allergy to whatever kind of metal they use. So it created this horrible rash on my wrist here. So, that's the case where I would say, okay, your Fitbit is great. It's monitoring your steps and you're getting more active, but you have this really ugly rash right here. So we've got to solve that. So if you want to continue to use it, we need to maybe figure out a way to keep yourself from in contact with that metal that it has. Maybe put a piece of tape around it or something so that it doesn't touch your skin, or put a cloth, or, figure something out, change the clasp. Call the company. I mean, there's always something that you can do. So that would be an example where you would intervene and you would do more of an integrative approach with the patient, where you say, okay, I want you to keep using it. It seems like it's really helping you and you're getting a better workout, you're more active, but you know what, it's actually hurting you also. So we need to figure out how we can actually improve that. And so then make sure that you give them a prescription for their rash, and sometimes it's just stop using it and the rash goes away. And if it's a contact dermatitis like that, then it's an easy solution. So think about that when you're thinking about these things, that it's really easy right away to just kind of say, no, that's not cool, you shouldn't be doing that, that's not ever going to help you. You don't know if it's helping the patient or not. So you want to just kind of get as much information as you can. Magnetic fields, you hear a lot about these, magnets that you can wear, and the magnets are going to, move energy back and forth from this side of your body to that side, or from this side of your wrist to that side of your wrist, so that you get better from your carpal tunnel and whatnot. Does it work? I don't know. Ask the patient, okay? I think that's really where you get the information. You can look this stuff up, okay? All of you in here, the good news, at least right now, is every one of you in here has UpToDate, okay? You have access to the UpToDate websites or database. So you can easily go in there and put in, pulsed fields and see what the literature out there says on pulsed fields, and you're going to be able to decide whether this is something you want to recommend to your patient or not. Is it recommendable or not, based on the evidence-based data that you find out there in the thing. You might find that there's not very much evidence, or the evidence that you found is pretty negative, or that it's pretty positive. I mean, that's a decision you make together with the patient, depending. I think the ultimate thing is it helping the patient or not? And if it is helping them, then you've got a good solution. Now, if they're doing something like, okay, so they're going with the the biologically based practices. And so you've got a patient on Herbalife. Herbalife is extremely popular in this area, okay? So you've got a patient on Herbalife who's treating their diabetes with Herbalife only, okay? And they're not seeking, standard medical care. They're not doing, metformin, or, they're not doing a diet or anything. They're just taking some kind of, powder prep liquid that they mix with the Herbalife. I'm not trying to knock Herbalife, again, if it helps the patient and they feel great and their sugars are monitored or whatever, you know what? Maybe they didn't have diabetes in the first place, okay? Because I find it hard to believe from the literature that is out there, if you do a search on UpToDate on those products, on that specific item that Herbalife claims to cure diabetes, then you're going to find that the evidence is just not there for a cure or to manage the disease well enough to replace Western medicine. And so that would be seeking an alternative option. So if you had to refer to what type of medicine the patient is seeking in that case, is it complementary or is it alternative? In that case would be alternative, because they're completely replacing Western medicine, that is metformin, insulin, GLP-1s, 2s, SLGP, whatever, all those different combos that there are for diabetes. If they're replacing them completely with Herbalife, then that's an alternative treatment. And you've really got to assess that and see what is going on. So, if the sugars are well controlled, hey, you've got a patient who maybe it worked on, I guess. But I think more likely there may not be an actual diabetic problem there. And so you probably want to run some tests again and see really where the patient's at. And also, don't forget that, diet and exercise really has a lot to do with specifically hypertension and diabetes as well. So the healthier you are and the more in shape you are, the better your sugars are going to be controlled. And in fact, some people have been able to control their diabetes specifically just with diet and exercise, okay? That's not true of type 1 diabetes, but type 2, depending on your patient, there have been some that have been able to do it. So keep that in mind. So then, you go back to your patient, and so what are you using Herbalife for? What is it doing for you? Are you feeling it's helping or not? And then move from there, okay? So who uses CAM? So what are we looking at in adults and children here? So in 2000, so look at the differences. So in this particular study, we had 2002 and 2007. What was going on there? So we saw a little bit of an increase. We also see in 2007 children starting to use these particular methods as well, so 11.8 in this particular study. 40%, okay, is a pretty large number. That means there are going to be quite a few of your patients in one day that you're going to see that are actually going to be doing some type of CAM treatment or seeking some alternative. So it's important for us to realize that this is out there. It's not 1% or 2% of the population. It's a large percent of who you're going to be seeing. That's why it's important to know what's going on. How old are CAM users? So you're looking, for the most part, it's going to be around middle age or so, okay? So around 50 years old or so, 50 to 60 is going to be really the highest population that you're going to be seeing using these sorts of treatments. And then you can see the numbers of everyone else there. But, anywhere from about 18 to age 84, okay? Again, how large is that population? That's a large population seeking these types of treatments. So that's good information to know. Race, ethnicity, and CAM. So which races, which ethnicities are going to be seeking this type of stuff? So American Indians, Alaska Natives, definitely really high. They really practice this stuff still, and they actively seek it. In the valley, we have peyote farms as well that are run by the government, where American Indians can purchase their stuff for religious activities, etc. So that does exist even locally here, okay? So we do get that population. And then you can see the others here. Now, specifically, if you want to look at Mexican-American numbers and Puerto Ricans, etc., they're all listed here as well so that you can know the breakdown on the Hispanics there, okay, and what those particular numbers looked like for this particular study right here. So again, what is the take-home point of this slide is large numbers, okay, the numbers of people that are seeking this, so that you know when you see a person, you don't necessarily have to profile them, but think about their culture, think about their background, and how that might play into today's healthcare. They might not be using the stuff at all. They might be part of the 60% that doesn't, but at least you need to be ready for those that do. So what are the most common therapies that are being sought out as of this study in 2007? Natural products, okay? So the biologically based domain is really where it's at. For the most part, most patients in this particular study were looking at natural products that they were taking, followed by deep breathing, meditation, chiropractic, osteopathic care, so on and so forth on the continuum by this particular study. Now, of the natural products, since they were the highest, which were the most common natural products in this same study, we found that fish oil omega-3s were the most common. I know I'm on one twice a day. Maybe some of you are on them also. All cardiologists are recommending right now. So this is the case where integrative medicine has really started to play a role specifically in cardiology and specifically in endocrinology. So I don't know a single cardiology patient out there that's not on an omega, okay? Most, if not all of them, are going to be on an omega fatty acid fish oil at least once, if not twice a day. And many diabetics are now on these as well, okay? Because the studies and the evidence actually does show that there is a benefit from taking those. So we're actually able to prove with traditional statistical quantitative research methods that these actual substances here actually do help in those particular conditions, okay? Now, the studies are focused primarily on conditions like hypertension or conditions really like coronary artery disease is really where it's at. We are showing definitely some improvements. Glucosamine, chondroitin is the other one, okay? You find that a lot in your arthritic patients, okay, and your older people. They buy this by the barrel at Walmart, okay, because that's probably the cheapest place you can find it. Or at Sam's or Costco also, you can find it pretty cheap. Does this work or not? The literature is still 50-50, okay? You really have to ask your patient if it's helping them or not. It doesn't help every single patient for their arthritis, but you'll find that many of them do show a benefit. Echinacea is another big one, very popular in the pediatric crowd. Echinacea is an herb that you can take to prevent yourself from getting cold and flu type symptoms, okay? It's shown to be protective. Many of the studies are now, also the evidence is pointing to a benefit, okay? That it in fact is showing that people who take it do have less occurrences of the cold and cough type symptoms. So who do I recommend that for? Any kid who can afford it, because it's not paid by insurance, so any kid who can afford it. Or I definitely tell every teacher that I ever see, you got to get on echinacea, okay? Vitamin C and echinacea every day. How many times a year are they sick with cold-like symptoms? At least 13 times. That's the average that a teacher is sick. A daycare worker is sick even more, okay? So they are sick every single month. Not just the kids, but the teachers, okay? And the daycare workers and the teacher aides and anybody working in schools in those confined areas with all of those germs in the air, definitely they're going to be sick a lot, okay? So I expect them to be sick quite often, and so why not recommend something that is showing to be very efficacious? Same thing with zinc, okay? So people who take zinc also are going to be, it's not listed here, but zinc is also another one that prevents you from having lots of cough and cold type symptoms. So I might say, you know, go out and get Coldies. If you're going to buy any lozenges at all, buy the Coldies lozenges, because they contain not only vitamin C, they also contain zinc, which, again, the evidence is now pointing to this, you know, a benefit. Airborne, people, oh, well, I'm taking airborne. Okay, airborne is a load of crap. Remember that they were found out and they were exposed on national television that it was just a big scam. Okay, it's nothing but a bunch of vitamins put together. Didn't have anything to do with a benefit. So the idea about airborne was that if you chewed on this tablet specifically and you were on a plane, you were able to avoid getting sick from germs in the plane that were circulating because you took this supplement and it helped. And then they showed, then all the evidence came out as soon as that happened, and then all the evidence refuted that, and there was no actual, you know, benefit ever shown. You know, but you know, there's no benefit shown for most things that are available over the counter that are some of these supplements. So you really have to look at the literature. And now, looking at the literature, it's still not pointing at a benefit. So it's nothing but taking a multivitamin is really what airborne is. So you can continue to recommend things like airborne, but you know, again, what does the patient want it for, and are they really going to see a benefit? Should they expect not to get sick? First of all, planes have HEPA filters, okay? So you'd have to be sitting next to somebody who directly coughed on you to get sick, all right? As opposed to, you know, oh, I just breathed the air and somebody in the first class was coughing up a storm. Well, you know, there are filters in the planes, and so they do filter out a lot of those germs that are airborne. So not too sure that there's a big a big exposure risk there. So flaxseed also really common lately. Lots of flaxseed being incorporated into a lot of diets and getting that fiber in, and lots of kids taking the flaxseed as well. And you can see all of the other ones that are listed there as well. Coenzyme Q10 tends to be very popular also in cardiology along with the fish oil. So you might see patients that are on coenzyme Q10. It's a little more expensive, but lots of people are on it in cardiology that you'll find. All right, what conditions? So people are seeking out CAM and complementary alternative medicine for what? The number one diagnosis for this is going to be back pain. Okay, lots and lots of people have back pain, and lots of people are seeking help for that. So what sorts of things can you think about that you would go get complementary alternative medicine for with back pain? Ideas? Chiropractics, okay, they are wonderful 100% experts at back pain. I mean, they can do other things, but these guys are really, really good at back pain, especially, okay? You have one chiropractor in the audience, so maybe he can vouch for that or not, I don't know. Maybe he's trying to hide from me anyway, right? But in any event, chiropractors really do a good job at spine. I always say that to patients, you know, if you're going to go to a chiropractor, you need to go for spine. And you know, one of the things that I like to say about this, and I'll say this a little bit later in the lecture also, is don't knock it till you've tried it. That's what I always say about a lot of things in life. But especially with CAM, if you've never tried it, don't judge it if you don't know what it is. Especially if you don't know a thing about it, you haven't bothered to look it up, you don't know what the definition of it is, you don't know why it's being used, what the pros and cons are, then why have an opinion about it if you don't know what it is? So I recommend first that you find out what it is. And if you have an opportunity, if you have an ailment or a problem that would indicate the need for that sort of CAM, go out and try it. Why not? You'll be able to afford it, trust me. And see what you think. Because I found that a lot of times when I've been very judgmental about some of these CAM things, I go out and try it and I find that I love it and it's great and it works for me. And so then I'm like, well, you know, why have I been so negative about this the entire time? If I myself tried it and it worked and it was great, then I use it. So, you know, for instance, with back pain, you know, years ago, coming from an ortho background, I never would recommend chiropractics at all. I didn't really believe in them. You know, I had a chiropractor who told me that, you know, he could cure the world with, I don't know, one little herb or something like that. And I'm like, okay, well, I can respect that, but it's not standard medicine, you know. So there was a problem there. But, you know, we'd refer a lot of patients for our back issues and spine problems to the chiropractors. And they did great therapy, great adjustments, and, you know, great work with us. And then we worked with them, prescribed medications, and, you know, they'd give us recommendations and whatnot. So it became kind of a symbiotic relationship. But it wasn't until I actually went to a chiropractor myself and had treatment for a really bad neck pain, and this was actually last year, that I finally kind of crossed over and said, you know what, this stuff is real and it works. And I was very happy with it because I had gone standard medicine. I had gone to several specialists and several people who did trigger point injections. I was on all kinds of medications and pills. I mean, I was all zombied out with all the different kinds of painkillers that I was on. I had massage, I had adjustments, I had traditional chiropractics, but then I went to this other guy that does a little bit different method, which involved a lot of pressure point, almost reflexology, sort of Rolfing type things, and that got rid of it. I mean, it hurt like the dickens, but it got rid of it like within 3 sessions, and I couldn't believe it. You know, here I was 6 months with this excruciating pain, couldn't even move my neck, and I got rid of it by going there. So, you know, that kind of made me a believer, at least for those sorts of treatments and utility for pain specifically, back pain, neck pain. So that really helps. So don't knock it till you try it. This is what I'm trying to say. The other experience I have with this also is like with acupuncture. So, you know, a lot of people, I've been to acupuncture for weight loss. That doesn't work. I'm going to tell you right now, it didn't work for me. So that was a big no. But, you know, I sent a lot of patients for Bell's palsy to acupuncture, including my dad, who got better within 2 treatments, something that would have taken 4, 5, 6 weeks to get better, typically on its own, because, you know, in Western normal medicine, we always say, you know, here's a steroid, it might work, it might not, and then the rest is just a waiting game, okay? But with the acupuncture, it worked within 2 sessions, which I thought was amazing. And it came from a recommendation from another friend who had sent patients there. And so I found it to be very useful. So now I do definitely use that, incorporate that modality in my treatment for Bell's palsy specifically, because I feel it is definitely good. Now, the problem is it's not covered by insurance, and, you know, if the patient can afford it, great. If not, you know, then we have to just go with traditional medicine. But if there is an ability for the patient to seek these kinds of treatments, Why not? Especially if you feel it works. But until you have experience with it, it's really kind of difficult to incorporate. Yes? You changed your hair again, girl? Here, keep track of you. All right. What was that?
In one of the readings, it was talking about, not the chapter portion, but the other one, it was talking about how now PAs and physicians can now take programs, but it's certain
Yes.
programs it still is available when we finish.
Yes, there are. In fact, there are whole residencies and whole fellowships that are geared toward this type of integrative medicine. They're out there. Absolutely. If they're available for PAs and you're interested, there's none in the Valley. No, none in the Valley. But if they're available for PAs, some of them are online also. If they're available for PAs and you're interested in this stuff and you want to integrate this in your practice, and that's the kind of practice you want to have, by all means, definitely look into it and get it done. One of my PA classmates actually became a naturopath. So she stopped being a PA and wanted to go sort of the naturopath way. And in New York, naturopaths are licensed to practice there. So she has her own practice as a doctor of naturopathic medicine and does sort of that route, thinking also about standard medicine. But I knew even in PA school, she was a little different than the rest of us. Her thinking process was different, and the way that I don't know if it was just her upbringing or what, or where she grew up, but she was from New Hampshire. So she had a very different way of thinking of life and of thinking of disease, which I thought, I don't know that she'll ever be very successful in traditional, Western medicine, because I think she had to find a way to mix. And from what I heard from her, she never did find a way to mix the two. So I guess integrative medicine didn't work for her, so she went the complete naturopath route. So now she's a naturopath in New York City. So that's what she's doing. In New York City, people can afford that, And also, since it's a licensed professional in the state, their Medicaid programs and whatnot pay for that, So in our state, among other things, our Medicaid doesn't pay for. That definitely wouldn't be one that is paid for. So Pediatric CAM. So these slides are basically the same as the yellow ones we just saw. It's just giving you the same numbers, but now for PD. What's going on in pediatrics? Very definitely something that we see. Natural products are definitely going to be also the most popular in pediatrics. Parents are taking their kids to chiropractors and osteopaths as well. And the thing about osteopaths is it's kind of a one-stop shop, right? Because you can get, if you have an osteopath that is actually practicing osteopathic medicine, then you get a little bit of both worlds. You get a little bit of standard, traditional Western medicine, and you get a little bit of the manipulation techniques and other things that they do. Dr. Jones could probably tell you a lot more about that since she is a DO. She can tell you about some of the techniques they do. She still practices them and uses them actively in her practice, so she might give you some insights about what that's like. And then the others are also listed here for the kids as well. Like I said before, echinacea is probably the most common out there. Vitamin C is not listed here because it's just a vitamin that's really common out there, and it's not really considered to be alternative or complementary. It just is what it is. It's a vitamin. But these things that are listed here definitely are something that are additional to what they already do. Again, same thing. The back and neck pain are going to be most commonly sought after for pediatrics. Head and chest colds are second, obviously because they're kids and they're pretty much always sick, especially if they're school age and in schools. All right, so this particular slide here, so what, now what, okay? So I've told you all of these things. I've kind of introduced you to the different domains for CAM, told you what each of the domains involves, the types and examples of things in there. Why should you care? Okay, should patients be doing this stuff? Isn't it dangerous? These are some of the questions that you hear. Does any of it even work? And then finally, I already have too much work. Now I have to know this, okay? So it's a lot of stuff. So I want to just take 2 minutes here, a little quick conversation about what are some of the answers to these questions. So why should you care? Okay. So your patients might already be using this coming to your office, so. Mm-hmm. Okay. Okay, so your assumption then is that we do want to do a holistic approach, right? Not everyone, I'm not here to say you should be doing holistic medicine, you should be doing integrative medicine. I'm just saying this is a way of doing things in life that is different from maybe the regular way. And it might actually be of interest for you to look into this because so many people are on this, okay? And people sometimes get turned off, and we'll find that out in a slide in a minute. Ashley.
If you prescribe a medication
Mm-hmm.
that might interact with some of their herbal supplements,
Mm-hmm.
but you don't know that they're taking that,
Mm-hmm.
so you should figure that out.
Correct, yes. There are definitely some herbal supplements that are big problems, like, for instance, St. John's wort is one of the big ones, that interacts with a lot of medications, and they're actually pretty ugly interactions. So you really have to know, you should be asking what they're on. Many times you skip that because your triage personnel do that for you. So when the patient checks in, they ask, what medications are you on? Keep in mind that your triage personnel might have taken a course for 2 months on how to do vitals, okay? They're not medical experts on collecting data. You are, all right? So you really need to do some of this work yourself and make sure that it is complete and thorough. Or you need to train your staff who's doing it for you. You need to train them to do it accurately. And so part of that would be to make sure that they find out, like we said in the medical interview section, remember I said on the ahistory mnemonic, okay? It was not just medications, but also over-the-counters, supplements, etc. There's a reason that I drove that in, is because we want to make sure that we do get that information to avoid these dangerous interactions. Because if something's working for the patient and it's not dangerous to them, great. But if it's working and it's dangerous, then we've got to have a conversation with the patient. If it's not working and it's dangerous, then we have to have definitely probably a more forceful conversation with the patient. So definitely there's other reasons. Anybody else on these questions? It's a lot of stuff to know. Do you need to know it? You don't need to know it all, okay? So the last one is kind of a tricky one, all right? So yes, we do have a lot to know. Yes, we have a lot to learn. So many new medications. I can't even keep track of the new medications that are out there for diabetes and hypertension, much less now learn a whole sort of book full of natural things and herbs and, go sit down at Whole Foods and learn everything that's on the shelf, okay? That's a difficult and daunting task, okay? So you don't have to know it all, but you have to be willing to have an open mind to find out what is going on. What is your patient taking and why? And once you see it, then you're going to have to do a little bit of research on it, okay? And don't be afraid to tell your patient, I don't know very much about what you're taking. Let me look it up real quick, okay? I think I gave you guys an example of a patient that was taking like a Brazilian nut or Brazil nut or something. Remember that one? Yeah, I don't know what the heck they were talking about. And then I looked it up, and I couldn't understand them, really. And it ended up being just a regular Brazil nut. And so I was like, well, it's just a nut. So it's not really a big deal. But I thought it was some sort of crazy, ephedra-type herb or something. I didn't know what they were talking about. So, but I educated myself about it. And then I was able to give a better recommendation after I found out, oh, that's what you're talking about. Okay, well, then I can give a recommendation that I'm okay with that. Because nuts are never a problem for the most part. So between 40 and 70% of CAM users do not disclose to their use to their physician. Why? Why might you think? So many people don't ever bring this up. So what does this slide tell you? Apart from why, this slide is telling you you need to ask, right? So your history-taking skills here need to really come into play. You've got to be asking these questions. Are you on these sorts of things? We already found out that up to 40–50% of the population in certain age groups are going to be on something. We need to find out what they're on. It's not a question of are they taking, it's a question of which ones are you taking, okay? And that's kind of the approach I take, is I assume that people are taking things, looking for things, going to, in our local area, they most likely maybe go to Sprouts or Vitamin World, Vitamin Shack or Vitamin Shop. I keep them all confused, but they might go to one of those places, and they're going every month to get their regular supply of coenzyme Q or whatever it is they're taking. Or they may just be going to the Walmart or Walgreens and getting something there as well, but I want to know what it is. So here were the responses in this particular study. 60% said, my doctor never asked. That's a problem. 60% said it wasn't important for my doctor to know. Well, why? Why does the patient have that assumption? That's a bad assumption on the part of the patient, okay? So we need to make it clear to the patient that anything they take for their health that involves their health really should be something they should disclose to you for sure. 20% said, my doctor wouldn't understand. What is that telling you? It's telling you that you've got judgment going on, okay? You've got a clinician who judges everything that comes out of the patient's mouth. And I hope that this course through the period of the past 15 weeks has really taught you one thing, and that is not to judge a patient for what they tell you, okay? Keep an open mind and find out, just get the facts and gather the data and make a decision after you've gathered that data, but don't make a decision until you have. 14% said my doctor would disapprove, okay? So we've got definitely a prude there, or a type of clinician who I know he's not going to want me to be on this. But why? So find out why would you disapprove of them taking this medication? Well, because they have diabetes and, taking all these sugar pills in one day is probably not a good idea if I have diabetes and I know they're going to get after me. And patients will tell you, I know the doctor's going to get after me when I go because, I've been doing this and I have been doing the diet and I have been taking my pill, like I have or whatever. But I never like to have patients that are afraid of me, okay? Students is another story. But patients, I don't like for patients to be afraid to tell me things, okay? So I do try and have an open dialogue with people so that they are, willing to tell me as much as they can so that I don't miss anything when I'm trying to deliver care. 70% of patients see their physician before or concurrent with their visits to a CAM provider. So that's a very important number. The majority of people who are on CAM are going to be seeing those other providers either while they're seeing you for the back pain or, right before you or right after you, okay? So they're doing both. They're balancing both systems, both treatments, and one may be negating the other. One may be empowering the other. One may be completely not helpful at all. But we don't know that until we ask, so it's important. So moving into the last section, which is integrative medicine. So how do we move into becoming more integrative and getting these skills in? It's definitely a paradigm shift for sure. It's a different way of thinking, and it's thinking about a disease-centered approach, which is the medical model. That's how we teach in this program, in every PA program, in every medical school. They're teaching a disease-centered approach. That is conventional medicine. Or changing to an approach in which the patient values and their participation is more central. So it's almost like saying going from a traditional medical model to more of a nursing model, okay, and kind of mixing those together. Because the nurses definitely follow that other continuum, okay? So they've been doing integrative medicine all this time. In fact, one of the nurses, I forget her name, but one of the nurses on faculty usually comes by and gives us all these flyers about all these things that she brings. She's kind of their specialist on CAM in their department, and she's always bringing us flyers about those things going on. Some of them look really interesting, and some of them are things that, I don't necessarily have an interest in. But nonetheless, they're available, and the nurses are really focused on that. There's a lot of literature out there in the nursing literature about CAM and how they use it and how they integrate it. And it's just now sort of becoming more popular in standard medicine, but it's still faced with a lot of ridicule, a lot of judgment, and definitely there's a lot of myth and just inability to understand what any of these treatments can do. So definitely it's up and coming, as Andrea Lynn said. There are definitely programs, fellowships, residencies that are focused on CAM, specifically in integrative medicine, that are now being followed by some of the bigger medical centers in the country. So we're definitely starting to see this. Also, if you don't think integrative medicine is big, take a trip to MD Anderson Cancer Center. And if you have any patient, any loved one who's ever been there, you're going to find that they have a whole website, whole department, whole part of the hospital that's devoted to CAM. That's devoted to what else can the patient do besides traditional standard medicine, chemotherapy, radiology, and taking your pills. What else can they do to improve their care? Now, they never recommend alternative treatment. So they never recommend stop coming here and go to Tahiti and, drink this pill, drink this tea for, the entire time you're there and lay out on the beach and you're going to be fine, your cancer will be gone. They never encourage that sort of thing, okay? Because believe me, those alternative options exist. They never encourage that, but they do encourage, what else you can do. What else, bless you, what does the evidence show that actually can help your symptoms become less, your cancer symptoms become less? Your symptoms from chemotherapy, how can we improve those with some of these alternative treatments that are out there, specifically for pain control? So you'll find, and I gave you some links to this on iTunes U specifically, on what some of these things that are doing specifically at MD Anderson to address this sort of integrative medicine. They do quite a bit of it. Yes?
I have a question, would you, as a provider, suggest some of these things to people, or do you just talk about them when they bring them?
I do suggest them. So like I said before on the example with the Bell's palsy, any patient I get with Bell's palsy, I will tell them about the benefit of acupuncture because I believe in it and I've had patients who have improved from it. So I will tell them, there's this other treatment that you can seek. This is what it's about. It doesn't hurt. They're not sticking a needle in your, it's a needle, but it's not going to draw blood and whatnot. And so we talk about some of the risks and benefits of it. And I will recommend it. I'll even give them the phone number and the name of the provider. Okay, so, and we'll go into that in just a second. It's part of your skill set of how you're going to integrate this. I have to admit, I'm not fully integrated. I'm not fully integrating all 5 domains, right? Probably because I need to do research on a couple of them, but I would say at least 3 domains, I'm pretty active in my practice about getting some of those things involved. Specifically the biological-based version there, where you're recommending fish oils, omegas, and you're recommending coenzyme Q, glucosamine, all of those things. I mention them as part of the treatment plan. So in my patient ed, I will make sure that I talk about, here's what you can do apart from taking this pill, apart from taking your ibuprofen, 800 milligrams 3 times a day with a lot of water and with meals to avoid GI upset, so on and so forth. I will then start a spiel about, these are the other things that you might go out and find. Sometimes I don't have time, so I might find that I skipped over it, and then the next visit, the same patient might come back and they'll ask me questions. Hey, what about chondroitin, or what about glucosamine? Do you think it works? And I can tell them what the literature shows. Well, the evidence isn't that really conclusive. It's really about whether or not it works for you individually, and everyone's different. So try it out. Some people have told me it's great. Other people have told me it does nothing for them at all. Some people tell me certain brands work and other brands don't. So, that's another way to go. So another really common one that I always include is for GI upset and diarrhea and gastroenteritis, I always recommend yogurt. I always recommend doing some sort of lactobacillus recolonization after that. If you're doing surgical patients after doing the full cleanse, the full GI prep before their surgery, I always recommend, after surgery, start on doing some type of lactobacillus recolonization so that your GI system won't freak out, because all the normal flora are gone. So I actually regularly recommend that, especially with diarrhea cases and gastroenteritis. I'll always include a spiel about lactobacillus and getting those normal flora back, because they do become disrupted when you're sick, or getting surgery or whatever. Yes.
I just was wondering, when my grandfather was sick with cancer, and we had him on the East Coast, and they really integrated diet into the medicine, not alternative, but like you said, like the cancer American.
Mm-hmm.
Really focus on the diet, how they better manage the chemo.
Yes.
And to me, down here, we're lacking in that. So
Mm-hmm.
how, as a provider, do you work?
Well, it's up to the provider. Okay. So I think it's the next slide. 2 slides from now, we're going to talk about how, as a provider, you would start to kind of dive into that particular area. And, the Valley is not our backward place in medicine. We're pretty up and coming and, cutting edge. Yeah, there's certain specialists that you have to go up north to see. But for the most part, we have complete care down here. Now with the medical school, I think that's only going to make it to where people don't have to go to San Antonio and Houston and Dallas to seek certain specialists. They'll just be able to stay here. So that's going to be, I think, the improvement that we get. Keep in mind that many of these places that have all of this available is because they do have medical centers and they do have medical schools where they can support that sort of infrastructure. And we've never had that here, really. And now that we are, I'm hoping that that's going to change and that's going to really bring people over. And it really just depends on your provider. There are some providers that really have, or clinicians, that have really embraced this stuff. And others are just still kind of, Some of them embrace it for the wrong reasons. Like some of them embrace it because it's, cash money and cash pay, and they can really, make a buck from the patient, whether or not they believe in what they're doing or not. And others really genuinely believe in the product. They might use it themselves. And then they also recommend it to their patients. We see that a lot, like with hormone replacement therapy. going with more natural plant-based substances for hormone replacement as opposed to, taking pills and drugs. Because the literature kind of has pros and cons for the standard medicine and HRT, which is hormone replacement therapy, you see that a lot of people are actually embracing some of the more natural CAM sort of products that are available for HRT. So how we do that, we're going to discuss in just a minute on how we can start to get there.
Would like to you have contact with a dietitian, like your patient with cancer?
Mhm.
You in direct contact with the dietitian?
You can. For cancer patients, they should never be managed in a family practice, first of all. Cancer patients should come to family practices for, their everyday health care, colds, coughs, congestions, whatever. Their cancer shouldn't be managed in a family practice. That's kind of hard to do on a complete, very good level, unless it's rural. I mean, if it's rural medicine, then I don't know, there's a conversation to be had there. But, if it's a place like this, they need to be at the cancer center being treated there, if not at MD Anderson or somewhere like that, where they have all of those resources available, where they have nutritionists and dietitians available to help them, where they have some of these other therapists that can help them with different things that they're looking for, and that they're covered by the insurance, or they're free, offered by the institution. So that's the reason to kind of get those types of patients, making sure that they get into that particular system in that process so that they have those items available to them. Because if you don't, and you're managing them from your office and you're not equipped to do that, or the insurance doesn't cover it from your office, from family practice, like, if you have a diabetic, for instance, not all diabetics get nutritionists covered on their insurance. Some of them do, but not all of them. So, that, and in cancer would be even worse. Like, they're pretty much covered for all of them if they're coming out of a cancer center, but they're not covered in family practice. So it depends how you and where you get them the resources. So you have to work with what type of payment options they have. Yeah, sure. So, so that's just more definition. So how to? So getting to the question that Vanessa had here is, how do we begin to do this kind of thing? The first is build a database. What's available, okay? You've got to familiarize yourself with what's out there. So in this area, what sorts of treatments? Well, I know that for sure there's massage therapy, okay? There are chiropractors all over the place, so they're available too. There are faith healers, curanderas, for those Hispanic, Mexican people also that follow that. There's that. There's also people who do, podiatry is not alternative medicine. Well, it is, but it isn't. It's kind of weird. It's kind of somewhere in the middle. But there are podiatrists for foot issues and foot ailments and things. There are podiatrists as well, so have a list of them. Pharmacies or places like Hector's Health Company, Sprouts around here. So you have to recommend a patient to go get everything organic, or they had to go get some, weird herb that they can't find in a normal place. Well, you should have a list or a database of where all these places are, like Vitamin Shack, Vitamin World, Vitamin Shop, Hector's Health, Sprouts, all the different places they can get some of these harder to find items. So it begins with that, is collecting information about what's available. So look on your iPads, work with one of your staff members to start to compile a list of what things are out there for the different types of treatments. Now, depending what specialty you're in, you might look at your most common diagnoses that you have. So if you know by the slides that I gave you today, back pain is a big one, and you see a lot of back pain patients, well, then start there. For back pain, these are the types of alternatives and things that we can recommend to patients, and then look up each one and find out what the data shows, what is the evidence pointing to. You're going to find out how to do that in the summer in your evidence-based medicine course. You'll find out how to determine a good recommendation based on evidence. So you'll use that information that you gain in the summer to decide, well, I am going to recommend this particular treatment, this herb to the patients because the studies are pointing to that. Build a referral system. So once you've done that, is put these people in your system for referral. Have the list available for your triage people. So if your triage people are doing all of your referral forms and making the calls to offices to make appointments and all that for you, you want to have that available for them. So find those referrals, find providers in those particular fields that you're interested in using, that you believe in, that you have faith in, so that you can regularly incorporate them into your daily practice. So that's another one. Ask your patients who they see. So that's another way, that's a perfect way of starting. Asking the question, opening the dialogue. Have that conversation with your patient. What are they doing? What are they seeking? Who else are they seeing? Are you seeing anybody else for this problem? Okay, that's always a great question, okay? Look for summaries of available data. Again, should be evidence-based. We should be looking at what the studies are out there showing, for this particular treatment. You might find nothing, you might find very little, or you might find stuff that's negative, but it's up to you to decide along with your patient. Keep an open mind is very important for these types of things as well. And again, I'll say this again like I did before, try CAM yourself, okay? If you have any one of these things where CAM you think would benefit you, try it out. See how you feel with it. If you feel better, then chances are your patient's going to feel better too, okay? And so there's nothing like really having a personal experience with some of these things to really kind of jump on board with believing in what some of these things can do for you. So I recommend definitely that you do that. So what is the summary? So you can see the summary here. So it's all about patient-centered care. Since the beginning of this course, we have been talking about patient-centered, 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 okay? It's never provider-centered, and we've taught you so many different ways to ask patients questions, but always coming back to, is it centered around the patient and not yourself as the provider, okay? Because the patient is really who we are revolving around. And I like this little picture here down at the bottom where it says it's a prescription, and this prescription is for meditation, yoga, deep breathing, and guided imagery, okay? So don't be afraid to prescribe some of these CAM things also, okay? And if you are, document it, okay? What did you recommend for the patient to do so that you have a record of what you recommended and what your patient is either using or taking. I have an after-class activity that I created. You don't have to do it, okay? It's not required. I know you're busy. I mostly created it for next year's labs because we're changing the labs around a little bit, but so that I can have it ready. But try it if you want, okay? It's a nice little case. There are 10 cases. They're also more pediatric-oriented. And basically, the cases are asking you, mom says that she wants to do something different for otitis media, and your job is to go to the grocery store, like H-E-B, Walgreens, H-E-B or Target or Walmart, even Walgreens or CVS, and find alternatives on the shelf besides the thing that you prescribed or whatever. And whether it's safe or not, would you recommend it? Different questions for each patient. So if you have time, over the Christmas break, I always find it fascinating when I go shopping and I'm looking for, I don't know, Tylenol or whatever, but then I start looking through the shelf at all the other things that are available in the drug section of the store. I find it fascinating what I find. I always find something new that I never knew was there. And I recommend that you do that type of research because as providers, you're going to be asked a lot of questions about things that are available over the counter and things people bring you that they're taking. And if you don't know what's out there, then you don't know what to recommend, right? So part of this exercise is to familiarize yourself with what's out there. And the exercise really keeps you from going to Sprouts or Whole Foods or Central Market because those places are focused on these sorts of alternative things. And so we want to go to mainstream places, especially if you live here. Not everyone goes to Sprouts. It's a little bit, not removed, it's not a bad location, but the price, it's a little more pricey, and so your average patient's not going to go to Sprouts. They're typically going to go to Walmart or H-E-B. So that's probably where you want to start and see what's available and what you would recommend in place of whatever you prescribed your patient. So think about that. Think about doing it. I think it's a learning experience. Probably when you have a little more time, maybe you're doing your Christmas break and you're doing grocery shopping anyway and you've got time to kill, take a trip over with your shopping cart over to the drug section and just see what's out there and just familiarize yourself with the things. You'll thank yourself for it. It's really an educational little tour guide. Anything else? Any questions? All right, guys, it was real. We're done. Have a great break.